Hi, I'm Dr. Usha here today, and I have Dr. Neelam Jawad with me today, who is a lactation consultant, and she is international board certified for the same. She's also a specialist obs-gynae as well, and she's going to tell us today all about breastfeeding. Dr. Neelam, hello, how are you?
I'm fine, Dr. Usha. How are you doing?
Good, thanks. Now, tell me something. Why should a woman breastfeed in the first place?
Well, I would like to start with very famous quote that breastfeeding is mother's gift for herself, for child, and for the earth. Breastfeeding is associated with multiple benefits both for mother and the child. If we talk about mother, it reduces the incidence of multiple cancers, osteoporosis. It helps a female to return her pre-pregnancy weight.
That's an important one.
Yes, it's very convenient.
Good incentive.
Yeah, it's very convenient. And if we talk about babies first feed, which is colostrum, which is rich in antibodies, it's called as liquid gold. That thing, it prevents baby from number of diseases like some infections, some type 1, type 2 diabetes. It causes some jaw and mouth development better. And it helps baby lifelong from multiple
problems. Yeah, that's good. Now, I'm sure our audience also realizes, and we all know that we've been hearing it for a long time, that yes, breastfeeding is very beneficial to the mother and the baby. Now, being the God's gift, as you said, shouldn't it be a spontaneous one? And do women actually have problems?
Yeah, unfortunately, about 60 to 70% of ladies, they suffer from some problems somehow after delivery of the baby. And
I'm one of them.
Yeah, actually what happens, it is taken as for granted that a lady should be aware about pregnancy, about delivery and lactation, even though it's not true. Most of the time ladies have to face number of issues, and we have to ensure them that this is completely normal to have some issue, and we are here to help her.
Yeah, I think this is where a mother many times finds they find it guilty. Sometimes they feel that they're lesser because they're not able to breastfeed. And being a doctor, being a gynecologist, I have been through it. And my first child, when I was finding it difficult to breastfeed, it kind of brings your morale quite a bit down, thinking that, oh my God, everybody else breastfeeds, how come I can't do it?
Yeah, here actually comes another thing, because initially in the past we had grandmothers, mothers, they were helping ladies, but now as a nuclear family it has become more difficult for lady alone to deal with all these challenges.
Yeah. No, I think this is what I want to impress upon the audience, whoever is watching this, that having a problem with breastfeeding does not make you a lesser woman, does not make you a lesser mother. It is quite a problem in many of the women. So all you need to do is to find out what you don't know, and you can overcome this problem. And Dr. Neelam is here going to tell us that how we're going to overcome and what problems we face.
Yeah, actually most of the things, it is not a problem. It's actually lack of knowledge which is happening, because ladies are not aware what is actually normal. So what happens that immediate after delivery, most of the ladies' problem is that milk is not coming in. That's quite common problem. In that case, we have to make her sure that initial 2 to 5 days is the days when it is the minimal amount of milk. That which I already told, it is colostrum, which is the liquid gold. That few milliliter is more than enough. It's so rich in energy, so rich in antibodies that few drops are enough for the child. Actually, I would like to just add some things here. Here, all ladies should be aware that we need only 3 things to focus on. First thing is that milk production. Second thing is the transfer to the baby. And third thing is how to monitor that baby is getting good amount of milk.
Okay.
So in these 3 points, first thing I would like to add that how to build good milk, like how to maintain good milk production. So ladies should be aware that from 16 to 17 weeks of pregnancy till 2nd to 5th day of delivery, there is a little milk production which is very rich, as already I told you. That is colostrum, very energetic, rich in antibodies, and few drops are enough. So nothing to worry about that milk is not coming in. It's completely normal. And secondly, we will
So can I just ask you something? How do they look after their breast, and what care do they need to take in the pregnancy time before delivery?
Pregnancy time, actually it's not much required. If lady has normal breast and development of breast is normal, which is simply some enlargement, some fullness, if she is having in pregnancy, it is completely normal. But what she should do, that she should have contact of some lactation consultant or some support system around. What happens, because after delivery, when she is not aware of these things, she becomes panic and she just stopped doing this thing. So what is the getting ready? If she is normal, having normal breast, then no much preparation required, unless she has some inverted nipples or some
so in
problem.
case of any abnormality of the breast, it's very good to check it beforehand, make sure that those things have been overcome before.
But otherwise in normal case it is not required. First thing I was talking about, that milk production, how to maintain. So I told second, fifth day it's normal. After fourth, fifth day she will be getting some firmness and engorgement of breast. It is quite normal. In that case we have to take care of the production of milk. How we will do? Regular massage, expression of milk, even with the manual, some hot fermentation, some cold. So she has to just empty breast frequently. This is the most important, because it is supply on demand type of thing. If she is removing milk regularly, then production will be more and more.
So the more you remove it, don't worry about it. You can waste it also if there is excess milk, but the more you remove, the body realizes that there is requirement is there, so it will produce more.
It will produce. Second thing, it comes like transfer of milk, which I told. In that case, it comes position of the baby and latch of the baby. These two things are very important. Again, if everything is smooth, baby's oral anatomy is good, then it is not a problem. And if she needs some help, initially we can help with some midwives and all. It is the transfer of milk, as I told, through latch and position. That is the main thing we need to teach to the patient. On YouTube and all, there are multiple videos available. If patient is having some problem, then we can always help her like that.
So I think this is where most of the women find the difficulty. One is sometimes they're worried about the production of the milk, but that is something that they feel doctors can help or somebody else can help. But the latching of the baby and transfer of the milk, this is the part where only the baby and the mother will have to do it. And that is where you find it difficult sometimes if it doesn't latch on. Here I think experienced midwives, grandmothers, sisters, whoever is breastfed or lactation consultant like Dr. Neelam, they will come to help.
So latch and position. Third thing is that how we will make sure that baby is taking good amount of milk. So we covered these three parts. One, I told that production, second transfer, and third is monitoring of the child, whether he is getting good amount of milk or not. In that case, we have to monitor urine and stool output of the child. So in first 3-4 days, even twice urine and twice stool, it's more than enough. And we have to keep in mind that 7 to 10% of the weight baby can reduce in first 10 to 14 days. So patients, we have to ensure patient that even if baby is reducing weight, baby is thriving well, baby is passing good amount of urine and stool, then we are fine, and production and transfer is completely good.
As long as the baby is happy and playing and passing stools and urine, I think it's a happy baby.
And second, I would like to add that sleeping pattern of baby. It is completely first 2 hours, which is very crucial to start and maintain good milk. It is skin to skin, so babies, we have to start within first 2 hours, 1 to 2. Then after that, there is a start of sleeping phase of the child. Baby can sleep up to 14-16 hours in first 24 hours even. So that concern of the mother, that baby is sleeping a lot and maybe baby is not taking good amount of milk. So as I added before, that colostrum, which is thick material, even few drops baby is taking and sleeping again, it is completely normal pattern.
So it's having a power feed and a power nap. Okay. So now, what about sore and cracked nipples that most of the women tend to have? Is there a particular reason for it, or how do we treat it?
Actually, sore nipple is quite common problem. Initially, again, ensuring the patient that stretching and mechanical discomfort of nipple is completely normal. That is because of some hormonal changes and some edema because of IV fluid or some epidural. So initial phase, but if it is not cured within few hours, or if it is not cured throughout the feet, then we have to look into it.
How do we treat that?
Treating of that position and latch is very, very important.
I think again latching is, if the correct latching, most of the problems are solved.
If correct latch, and crack nipple is the secondary thing. If we are not curing or we are not covering this sore nipple thing, then after that second thing is crack nipple, which is quite I mean,
quite painful.
Painful, yeah. So if they are taking special care and this, then we have to protect sore nipple itself, so she will not fall into this crack and mastitis.
So from what I understand, correct me if I'm wrong, the whole of the areola needs to be in the baby's mouth. That prevents that gives rise to better milk transfer, and also prevents these cracked nipples. Most of the time, with babies only on the nipple without actually latching on properly with the full areola inside, these are the problems which occur. Am I right?
No, actually we cannot say full areola because it depends on size of breast and it depends on mouth of the baby as well.
Okay.
The only concern here is that baby should not feed only on the nipple.
Yes.
Okay, so what we need to do, if it is nipple, we have to just approach through the nose of the baby. If baby's nose is here and baby is opening wide open mouth, this is more than enough. So we have not to tell this to the patient, that whole part, because in that case it is more painful and traumatic for both of them.
Okay.
So we have to see about mouth and size of the breast and nipple also.
I have two more queries, Dr. Neelam. What happens to women with previous history of breast cancer? They've been treated for breast cancer. Can they breastfeed?
Again, according to research, it seems that it can happen. So if there is some reconstruction surgery after breast cancer, then maybe they can just, it can help with some tube system, like supporting tube system is there.
Okay.
And if mastectomy is done, then definitely it's not...
from the side, whichever the mastectomy is done.
And secondly, this, excuse me. Secondly, this radiation and all, it also affects on the tubal and ductal system, so production definitely.
So depending upon if it is a functional breast, as such you have had breast cancer previously, does not make a difference. It's the function of the breast, how much is retained.
Yes, it is function of the breast, and the second thing is it depends that what treatment is also given. So in that case also.
How about breast implants? People with breast implants, can they breastfeed?
Yeah, doctor. Actually, there are multiple things. It's not simply implant. If we talk about augmentation and reduction surgeries on the breast, and even in past surgery, some for benign tumor or something has happened, it depends on that for what reason it was done. If it was completely flat breast or tubular breast where that ductal tissue was minimal, in that case it is challenging to start with the feeding. But if it is simply for some cosmetic reasons, then if there is ductal tissue and tubal tissue, then definitely.
So normal breast tissue, if it's retained, then there is a good chance.
And again, it depends that site of implant. If it is placed behind this chest muscle, then it is easier. If it is placed above the chest muscle, then it is not. And again, most important is the incision site. If it is given under the breast in the inframammary fold, then it is easier to start. If it is given around the areola that interfere with the nerve endings here, then in that case that milk production will be
So women who are planning, young girls who are planning to have breast implants, if you go to your surgeon, make sure that you check with them whether in future you can breastfeed or not. That's if you want to. So is breastfeeding mandatory, Dr. Neelam?
Mandatory, 100% from my...
Okay.
As a lactation consultant, what I would like to tell here, as I told, that definitely it's a gift for mother, baby and earth. It's true. So it should be fully, definitely we cannot enforce patient that she has to do that. But whatever she is planning, it should be fully informed that how much important it is.
Okay. So I'm of a little different opinion on this one. Yes, breastfeeding is very important. It is very helpful to you, yourself as a mother, and also to your baby. But the only thing that I would like to say is that don't take it on yourself that if you can't breastfeed that you are a lesser person or a lesser mother. There are different ways of bonding with the child. Breastfeeding is not mandatory. It is not a pressure. If you can freely breastfeed with pleasure, please do it. If you can't, don't feel guilty.
True.
Your baby is still yours. Thank you very much, Dr. Neelam.
Thank you, Dr. Usha. Thank you so much. I hope it will help our patients.
Thank you.